The hospital has not been receiving all the supplies that they had ordered since the beginning of this year. They have been receiving only 30% of the items ordered that kept the hospital functioning. The hospital has been forced to work without surgical equipment, IV fluids, hand gloves and laboratory reagents. Without hand gloves, doctors and nurses are working under trying conditions to deliver babies in the labor ward. They were also facing difficulty treating patients without necessary first-line drugs and do procedures like putting in chest drains without necessary equipment to drain urine. Yet the hospital staffs are working under pressure using what is available to treat patients. The Western Highlands Provincial Health Authority was using other means to alleviate the problem. The authority had approved 250,000 kina from the project account to allow the hospital to buy urgently needed drugs, laboratory and medical supplies. The medicines in the pharmacy are critically low, and if they don't receive their supplies soon, the hospital will be without medicine. If this situation continues, the hospital will be forced to screen and diagnose patients only and refer them to private pharmacies to buy their own drugs. This report by Dr. Ripa follows report from Lay City about the general shortage of anti-malaria drugs and antibiotics in urban clinics. The National Department of Health is responsible for the supplying of drugs and medical consumables, but they have not been able to supply everything. Last year, the provincial authority spent over 800,000 kina to assist the area medical store to buy drugs. Dr. Ripa urged the public to look after themselves and avoid getting sick or injured during this election period, as the situation is beyond their control. Vasinata Yama, National EMTV News, Mt Hagen.